Doctors in Western New York are getting a lesson in how dangerous addiction can be. They will receive special training on how to better prescribe opioids and how to spot and treat addiction. But how tough will it be to get doctors to take part? News 4's Dave GREBER is here to take a look. Dave?
Yeah, Don, I think that's really the question that everyone has been asking. Opioid addiction has killed nearly 150 people this year in Erie County, and yet powerful painkillers like hydrocodone and OxyContin continue to be the #1 prescribed drug to treat pain in Medicaid patients. Local leaders and some of the medical community are saying it's time to shake that trend.
We need to make sure that today's patients do not become tomorrow's addicts.
Erie County's medical community held up a mirror today, saying they were the front line when it comes to curtailing opioid abuse. A $65,000 grant issued by the Tower Foundation is meant to ensure training for doctors on how to better prescribe powerful and sometimes addictive painkillers. County Health Commissioner GALE BURSTEIN says 147 people have died so far this year from opioid abuse, and that doctors shoulder at least some of the responsibility because of a tendency to overprescribe pills like hydrocodone and OxyContin during the past several years.
So often we hear from opioid addicted persons that their addiction originated at the doctor's office.
The medical director of chemical dependency services for Catholic Health System, Dr. Paul UPDIKE, says there's a reason for that.
The prescribing of opiates increased really for legitimate reasons, trying to treat people with pain, but without really, unfortunately, proper recognition that increasing the prescribing and exposing more and more people to these medications could have really dire consequences as well.
Those dire consequences are turning more and more people from legal drugs to the street when prescriptions and options run out. UPDIKE says it's often the path of least resistance.
I would definitely say that the prescribing of opiates became much more liberalized.
The question remains, however, will doctors take advantage of this life-saving training?
As physicians, we are called, our first job is to alleviate pain and suffering. And this is definitely causing a significant amount of pain and suffering in our community.
Now, the training that's going to be provided to doctors locally is similar to what's being asked at the state level, but a bill to make such training mandatory has failed to even reach the floor in the Senate the past 2 years. Reporting live in the studio, Dave GREBER, News 4 at 6.